Assalamu alaikum. I'm Dr. Asif Nawaz, Junior Surgery Resident and Lecturer of Anatomy. So today's I'm very much busy and somehow sick. That's why I have made late for today's presentations. Okay, so today we are going to discuss a very important organ, that is the pancreas. You can see this is the pancreas. It is a leaf-like organ which is present just medial side of the second part of the duodenum and behind the stomach, and it placed transversely towards the left hypochondrium. Okay, so it is a way-shaped leaf-like organ. So what is it? Then it is a soft lobulated organ, consists of both exocrine and endocrine functions. That means it is a very soft lobulated. There are some multiple lobules present here, and it is a gland, that is a mixed gland. It has both exocrine and endocrine functions. So firstly you have to know what is exocrine and endocrine. Exocrine means this organ can produce some enzymes which will secreted into the second part of the duodenum for helping in the digestion and absorption of protein, fat and carbohydrate. And also it has some endocrine functions, that means hormonal. This pancreas will produce hormones like insulin, glucagon, pancreatic polypeptide, somatostatin, and the VIP-GIP, that means vasoactive intestinal polypeptide and gastrointestinal polypeptide. So these are the hormones, the most important hormones, which is very unique in reducing glucose level of the body, that is insulin, which is produced by the pancreas. Okay, so this pancreas has some parts. This is the head and the neck, body and the tail. So the parts of the body is correspondingly head, neck, body and tail. So it has surfaces and borders according to their parts. That means in case of head, it has two surfaces, anterior surface and it has a posterior surface, and the two border, upper border and the lower border. In case of neck, that it has also anterior surface and posterior surface, superior border and inferior border. And the body, that is, it has two borders, upper border, lower border, and the two surface, anterior superior surface, posterior inferior surface, that lies posteriorly. And the tail is a conical in shape, other than the corresponding or other than the other parts of the body. It is allied with the splenic hilum or attached with the splenic hilum with the linorenal ligaments. Linorenal ligaments, here we will later on discussed, and slightly attached with the transverse colon inferiorly, that is pancreaticus splenocolic. It is a splenocolic ligament and which also attached with the lower part of the tail. Okay, now the relationship, which is very important for the post-graduation exam as long as the undergraduate students. Now the head which lies just medial side of the second part of the duodenum, because the secretion which is produced from the pancreas will ultimately drain into the second part of the duodenum. And what are the relationship? Let's see the relationship. See, this is the black area that you are seeing seems to be a pancreas. Okay, so the pancreas, so we can see some vessels, some muscular structures and some glands present in relation to the pancreas. So most relation lies posteriorly. Okay, and here in the medial side you can see the second part of the duodenum, and the posteriorly, like this is the head, this is the neck, body and tail. So the relationship of the head corresponding to the bile duct and the superior mesenteric vein and inferior vena cava. Okay, so head corresponding to the bile duct, superior mesenteric vein, inferior vena cava, and the slightly to the left side you can see this is the abdominal aorta, most posteriorly it presents, and the neck you can see the curves of the diaphragm, left curves of the diaphragm, and this is the splenic, this is the kidney, so this is the renal vein, and you can see this is the splenic vein. Okay, splenic vein, renal vein and the left curves of the diaphragm. This lies posterior to the neck, and the body, that means this is the body from the posteriorly it has the splenic vein. Okay, splenic vein lies just posterior to the body of the pancreas. It has also a suprarenal gland and part of the kidneys and the pelvis. Okay, and the tail corresponding just to the hilar area or hilum of the spleen. It attached to the spleen through the linorenal ligament. So this ligament is sometimes asked in the exam, the how tail of the pancreas is attached to the spleen. It is mainly with the linorenal ligament. So most posteriorly, like the neck, body, most posterior you can see the big muscles, it is called the psoas major muscle, and also sympathetic trunk of the left side you can see here, and all the other structures like inferior vena cava and the gonadal vein. This is the gonadal vein, which that means testicular or ovarian vein of the left side that will directly comes to the left renal vein. Okay, it is one of the important topic that will be discussed later on. And so here this is the posterior relation of the pancreas. So you have to mention what is the relations of the head, neck, body and tail. So now the posterior relation completed. Now the surrounding relations, you can see the in most anteriorly you can see here the stomach. So body and tail is just lies posterior to the stomach. So it is a cross section, stomach is removed. So in the anterior relation of the pancreas has the stomach, the body of the stomach, and the laterally, that means the lateral part of the head, the second part of the duodenum, and the inferior portion has the third and fourth part of the duodenum along with the transverse colon. Here the cross section of the transverse colon, that means in the inferiorly the transverse colon is present, and the laterally to the left you can see the spleen or hilar area of the spleen. So that is the surrounding relationship. And the posterior relationship I already mentioned, that kidney, suprarenal gland, pelvis and left crus of the diaphragm, suprarenal gland and the abdominal aortas, inferior vena cavas, and the others, hepatic artery, common bile duct, others. So these are the posterior relations. Okay. Now the internal structures. It is a cross section of the pancreas. That means the pancreas, his anterior surface is withdrawn. Okay. If the part of the pancreas is slightly cut down, then you can see the duct. You can see there is a branching duct that lies anterior of the pancreas, and this is called the main pancreatic duct. Okay, this is the main pancreatic duct, and it has some branch which is look like the herring fish bone pattern. Okay, herring fish bone pattern it look like. So this duct is mainly drain the enzymatic secretion of the pancreas. That means pancreas will produce proteolytic enzyme along with lipolytic and carbohydrate splitting enzymes. That is histologically tubulo-alveolar in appearance. So there are multiple lobular appearance that present here in these areas, and the secretion will ultimately drain through the duct, and the multiple duct will reunited into the single duct and forms a main pancreatic duct. Okay, so this is the main pancreatic duct. It ultimately opens in the ampulla of Vater. So this is also called the duct of Wirsang. Okay, it is also called the duct of Wirsang. That means main pancreatic duct. So this main pancreatic duct will ultimately open into the major duodenal papilla of the second part of the duodenum, and this is another duct. It's called the accessory pancreatic duct or duct of Wirsang. This duct will take secretion from the uncinate process. So pancreatic head has two area. That is one of the head and is uncinate process. Uncinate process is slightly curved and downward. So now this accessory pancreatic duct will open into the minor duodenal papilla, that is 2 cm proximally of the major duodenal papilla. So here you can see some deep circular sphincter at I already drawn here. It is called the sphincter pancreaticus. That means pancreatic secretion will be controlled or secreted in a controlled manner. That means it must not be secreted a lot. That is what is necessary according to the food pattern. These two sphincter will ultimately control the secretion of the pancreas or pancreatic enzymes. That means the exocrine secretion of the pancreas. Okay. And now the histology. So the pancreas has endocrine functions. That means it has some special cells which can produce hormones. Like there are 4 type of special cells, that is alpha cell, alpha cell, beta cell, delta cell, PP cell, and so these cells are special cells. These are the paracrine variety. They will produce hormones. Like beta cell, which is present at least 68%, will produce insulin. Only on insulin is produced from beta cell only. There is no other parts of the body can produce insulin. Yeah, some insulin can be produced in the intestine, that is large intestine. Some bacteria can produce insulin, but it is very negligible amount. So it is very important. A delta cell will produce somatostatin. Alpha cell will produce glucagon. You know the glucagon is very essential when we are passing in a starving condition or in a stressful condition. The glucagon can increase blood glucose level, but the insulin is opposite effect. The only insulin that will reduce the blood glucose level, and the delta cell which will produce somatostatin, and it is called the universal inhibitor. So though the other hormones or other enzymes is inhibited by the somatostatin. So these cells are supplied by the fenestrated capillary. That is, these are supplied by the fenestrated capillary of the artery wall, and also these cells are controlled, or the secretion is controlled by the sympathetic and parasympathetic supplies. Like pancreatic supply is inhibited by the vagus, that means the largest parasympathetic variety, and the secretion is increased by the sympathetic trunk, that is the supply from the sympathetic ganglion, which is celiac ganglion, superior mesenteric ganglion. So these two ganglions give supply to the sympathetic branches, which will increase the splenic pancreatic secretions, and the parasympathetic is vagus, which will inhibit the pancreatic secretion, as well as same functions with somatostatin. Okay, that is the things. Now the artery supply. So pancreas is highly vascular organ. So this is the celiac trunk, okay, the main source of the pancreatic supply. So a main vessel, it is called the hepatic artery, common hepatic artery, and this is the hepatic artery proper. So common hepatic artery has a branch, it is called the gastroduodenal artery, which lies inferiorly, and this is the first part of the duodenum. So gastroduodenal artery goes posterior to the first part of the duodenum and forms the anterior superior pancreatico-duodenal artery. So it is called the anterior superior pancreatico-duodenal artery. And there is another artery which comes from the superior mesenteric artery. It is called the superior mesenteric artery. Okay. And it has a branch, is called the posterior inferior pancreatico-duodenal. So it is a anterior superior pancreatico-duodenal, and this is called the posterior inferior pancreatico-duodenal. They are reunited in the inferior surface of the body. Okay, the greenish area you can see the inferior surface of the body, and this is called the anterior surface of the body. So these two are confluence with each other and will give supply to the head of the pancreas. Okay, and the body, neck, body, tail, which is supplied by the splenic artery. You can see the splenic artery which gives supply multiply to the body and tail also. Now the venous drainage. You can see it is the posterior surface of the pancreas. So this is the uncinate process. Here is a gap or fold. So portal vein which comes through the gap, and so this is the superior mesenteric vein, and this is the splenic vein. These two veins are reunited to form a portal vein. Okay. So portal vein also gives supply to the neck and the part of the head of the pancreas, and also splenic vein will take drainage from the body and tail, and the rest of the portion uncinate process and the part of the head is supplied by the superior mesenteric vein. So the venous drainage is three: portal vein, superior mesenteric vein, and the splenic vein. So these three venous drainage ultimately gives the drainage of the pancreas. that is venous drainage of the pancreas. And the splenic artery, gastroduodenal arteries, anterior superior and the posterior inferior pancreaticoduodenal artery, splenic artery, gastroduodenal artery. These artery will give supply to the head, body and tail of the pancreas, and also neck. Here virtually the original pictures. So this is the gastroduodenal ultimately, and this is the posterior inferior pancreaticoduodenal. This is the anterior superior pancreaticoduodenal. Ultimately there are two branches. One goes along with the anterior surface of the head and one goes posterior surface of the head. These two head ultimately originated from a single artery, that is gastroduodenal. So a branch of gastroduodenal comes from the anterior surface of the head and another one goes posterior surface of the head, and these two head will reunited with another two vessels of the and posterior inferior pancreaticoduodenal. They will reunite with each other and forms a vessels. These two vessels give supply to the head of the pancreas along with the some parts of the second part of the duodenum. It's called the vasa longa. Okay, these are called the vasa longa. And you can see this is the splenic artery, and which also gives to the body and neck, body and tail. Okay, so this artery will give supply to the body and tail. You can see it is more clear. This is a superior mesenteric artery and this is the celiac trunk. So one, that is gastroduodenal, gives supply to, and here there is a two another posterior inferior pancreaticoduodenal. Ultimately they will reunite with each other and give supply to the head, and the splenic artery will give supply to the body and neck. Okay, so ultimately it is clear then. And now the venous drainage. I have told you that splenic vein has three important structures. One is a splenic vein that will give supply to the pancreas. It is a cross section of the pancreas to give more visual effect. So it is this splenic vein which will give supply to the tail, body and also neck, and here the superior mesenteric vein that will give supply to the head and uncinate process. Okay, and this is the portal vein. Also the portal vein also gives supply to the head. So portal vein, splenic vein and the superior mesenteric vein will ultimately give venous drainage to the pancreas. See the lymphatic drainage. So there are two group of lymphatic drainage that will ultimately make the lymphatic drainage more smoother, like pancreaticoduodenal lymph nodes. So this is the duodenum, this is the pancreas. So these lymph nodes are called the pancreaticoduodenal lymph nodes or the subpyloric or prepyloric lymphatic lymph nodes. And here are multiple lymph nodes, that is this is the pyloric or subpyloric lymph nodes, and these are the hepatic lymph nodes and the celiac nodes. Those are connected. So ultimately pyloric lymph node will drain into the celiac lymph node, and hepatic lymph node is also drain to the celiac nodes. And here these are the pancreaticoduodenal lymph nodes, multiple pancreaticoduodenal lymph nodes, and another pancreatico-splenic lymph nodes. These are the pancreatico-splenic lymph nodes. There are another lymph nodes here, because it is not here because author also deleted it. So this kind of lymph nodes is also present in this area, that is pancreatico-splenic nodes, and this is the celiac nodes. No problem. So there are two groups of lymph nodes mainly. One is pancreatico-duodenal, pancreatico-splenic. These two lymph nodes are the main nodes, and the other nodes are the superior mesenteric nodes, pyloric nodes, and the celiac nodes. Those will also collect lymphatic drainage from the pancreas. That's why any malignancy or any cancer, any tumor which has very poor prognostic features, that means the prognosis is very bad if any malignancy occurs in the pancreas, like carcinoma, head of the pancreas, and any other malignancy like sarcoma or others. So the prognosis or the rate of recovery of the patient is very low, because a lot of lymphatic drainage is supplying the area. Like here you can see there are a lot of lymph nodes are surrounding here. So any malignancy or cancers primarily spread through all the lymph nodes. That's why a total resection or total recovery is questionable. Thank you.